I'm John from Advanced Soft Tissue and Remedial Massage, also known as AdvanceSRM. I have a qualification in clinical soft tissue and remedial massage therapies, and I specialise in helping people that suffer with pain or dysfunction or discomfort that is due to injury or surgery, or maybe it's been following a severe illness, such as cancer, for example. One of the specialist skills I have, though, is to assist women during their pregnancy and beyond postnatally. But more specifically, I specialise in helping women that suffer with pain or dysfunction, whereby typical massage, general massage techniques wouldn't be enough to help them deal with that pain. So at the clinic, we use the specialist techniques to help people overcome, for example, Symphysis Pubis Disorder, or they might be suffering with Sacroiliac Joint pain. And beyond pregnancy, if they suffered with a traumatic birth, maybe they've had surgical intervention, then they're going to need specialist techniques to help them deal with the chronic pain that they might be dealing with post-pregnancy. Conditions, for example, that you might have heard of are diastasis recti, which is the separation of the abdominal wall, where the linea alba, a fascial band here, has been separated, overstretched during pregnancy, and the abs on the left and right are unable to get back. Another issue might be that they've had a C-section and they feel extremely tight through the abdomen and feel that they're not able to mobilise the front line as well as they might have prior to pregnancy. Another issue that they might have had is post C-section, they might have adhesive tissue inside which is binding down the fascia and binding the organs such that they feel restricted in movement and are suffering with some form of pain as a result. And it's people like me who are well placed to help you out with that sort of pain. So in this video, what I like to do is help you understand the sort of techniques that will be used in a typical session to help you overcome the pain that you might be experiencing. So I hope you enjoy it and I hope you learn something from this, and are encouraged to try out soft tissue and remedial massage therapy as an alternative to general massage. Okay, enjoy. Okay, now I'm going to work into the muscles that connect your shoulder to the skull and through the neck as well, on the right hand side here, Jess, okay? Mm-hmm. So here I'm going to work on a muscle known as the upper trapezius, and then below that levator scapula. Okay, we've also got the scalenes there at the front, more towards the side and the anterior side of your neck. Okay, and we'll be working all of this, releasing that tension you might be feeling through that neck, which can lead you to feeling discomfort in the base of the skull, headaches, migraines. It's really good for eking out the tension that you can feel through there. Okay, let's come on the other side. Just going to work through here. The knuckles. Good. You okay with that pressure? Good. Just going to use some bridging here, taking the tissue out towards the front and the back. Good, excellent. Bring that up. There's a little bit of drag there with my left hand, taking over the scapula. Okay, and again, up and around. And take that tissue with the left hand down the back. Okay, into the rhomboids. Just start to release the tension that you might be feeling in here. Okay, good, well done. Right, what I like to do now, Jess, I'm just going to work more specifically on the levator scapulae and the upper trapezius. What we're going to do here, we're going to have a sliding drag, okay, through the tissues, sliding lock. If you bring your ear up towards the shoulder, nice and smooth there, just drop it gently down towards the pillow for me. Perfect. You feel my right hand sliding through the fibres of the muscle there. Again, nice and slow down. Excellent, well done. Good, good. What I'm going to do now is work into the fibres of the levator scapulae. What you're going to do is lower that ear down to the bed and rotate, taking it forward for me, nice and smooth. I'll add a bit more tension to it there. Good, well done. One more time, same thing for me. Okay, and again, take it down. Excellent, well done. Really good. I'm just going to use the towel to add a bit more of a lock, so you're not going to feel a slide through the tissues now. So it's going to be a bit more intense. Bring the ear up for me. Okay, this is called soft tissue release. It's really, really good. You feel stretch through the fibres there. Can you feel that? Start to rotate for me. Excellent. And stop when it gets too much, okay? And again, nice and smooth down. Turn. Good. And you feel the line of tension change as I move my hand and as you rotate that head. Excellent, well done. Is that more at the back there?
Yeah.
Good. Okay, just going to do some transverse pull through with you actively rotating the neck for me. So you're going to move your chin towards your left shoulder for me. That's excellent, well done. Good. And again, nice and smooth. Well done. That's good. Put that down there. Good. One more time. And again. Good. Add a little bit more pressure there. You okay with that?
Mm-hmm.
Good. Right. We move now in towards the scalenes here. And S, sternocleidomastoid. What I want to do first, I'm going to take sternocleidomastoid, this muscle which connects the top of your chest in the centre towards the back of the ear here. What I'd like you to do is just turn your head towards me. Okay. Okay, we're just going to lift the chin up. Sorry, lift the chin that way. Good. That's going to pop out that muscle. There you go. Relax down. Good. I've got a purchase on that. What I'd like you to do now is look towards the opposite wall for me, nice and slowly, and you'll feel it just pulling away there. Can you feel that? Good. Back towards me. Good. I'm going to walk up and take the head that way for me, nice and smooth. Excellent. Well done. That's really good. Really good. I'm going to walk up there. That's fine. And again. I'm going to use the IAMS tool here, which is an instrument assisted myofascial release tool. What I'm going to ask Jess to do is I'm going to ask her to just take the shoulder forward. This is going to put all this tissue on stretch from the spine there to the medial border of scapula and through scapula. I'm just going to use this now, Jess, through the tissue there for you. Okay, I'm going to bring that tissue into a bit more stretch there. You okay with that?
Mm-hmm.
Good. So again, transverse strokes through fibers there. I'm going to come up on to the scapula there. And what I'm doing here is I'm dragging the tissue down to bring it into an elongated state as I work over the fascia of the shoulder blade and that connecting towards the spine. Okay, and up there. Good. Okay, so I'm going to use soft tissue release on the wrist extensors here. So Jess, what you do is engage those muscles for me. I'm going to lock down. Okay, and I want you to take the hand down. That's it, brilliant, well done. Back up for me, and again. Good, and one more time. Excellent, perfect. Can you feel that?
Yeah.
It's very tender, isn't it?
Yeah.
And that's a lot to do with the fact that, you know, you've got to use your hands to carry things. You've got to continue working, haven't you? And you've got all this added pressure throughout the body when you're having to carry that baby. So here I'm going to have a stronger fix. I'm going to use the towel. Bring it down for me. Good. Back up. Well done. And again. Excellent. Brilliant. I'm going to get Jess to rotate the arm around. This time she's going to start with her wrist in a flex position, and I'm going to work through the wrist flexors for her. Again, I'm going to use the towel here to get a bit more traction, a better lock. You can take the hand down, she'll feel it pull straight away. Good. And this is also going to help with the tendons that are attaching to the wrist and with carpal tunnel. Okay, and again, nice and smooth. Good. Well done. Back up. Excellent. Good. And again, well done. So if you feel any sort of discomfort in this area between the ribs and the hip, this is really good to do. If alternatively it's more towards the back of the ribs and into the hip, we can do a slightly different technique. So what we're going to do here, Jess, is a torque technique, okay? So I'm going to create some torque through the tissues there, taking the hip and the bump forward. All I want you to do is push your
bottom into my right hand there. Good. Hold it. Take a deep breath. Exhale and relax. Good. You okay with that?
Yeah.
You comfortable? Are you comfortable through the bump?
Yeah.
Good. 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 Okay, I'm just going to hold there. Again, push through to my hand. Good. Deep breath in. Exhale and relax. Good. Can you feel a stretch now?
Yeah.
Okay. Just going to hold that there. Okay, and relax. Okay. Right, I'm going to take the tissue that way now through the ribs and take the hip back. So you're going to pull into my fingers this time, Jess, with the hip. That's brilliant. Hold. Deep breath in and relax. Good. Well done. You feeling a bit of a stretch there?
Yeah.
Is it as intense as
No.
moving the other way? Okay. So this is very different for each individual. So I'm just going to hold there one more time, pulling into fingers. That's good. Deep breath in, exhale and relax. Good. And you just allow it to eat back a little more. Good. Well done. So again, this is really, really good for lower back pain. Okay, and any tension along that lateral line into the for this. Okay, so just going to mobilise that tissue up towards the hip for you. A bit more lotion would be better. Okay, and again. Good. Feel free to let that leg drop down, Jess, so you're not feeling like you're rolling back there. Good, well done. Okay. Let's take that muscle that way. Good. Okay, the pressure I'm applying here is just off the edge of the IT band. Okay, I don't want to be working directly on it because it can be quite painful. Here now you're going to feel me just moving the tissues out and over the IT band, out into the quads at the front and the hamstring at the back. Is that pressure okay?
Yeah.
Good. And up towards the top of the femur there. Good. Okay. And it's really nice just to apply some general massage strokes to the tissues of the leg here. It's very comforting, very, very nice to mobilise the tissues around this area, okay, with some general massage before we start to apply other techniques. Okay, just what I'm going to do now is I'm going to bring into play the small towel. I'm going to work on soft tissue release through the back of the leg first, okay? So what I'd like you to do, in this case, I'd like you to, as your knee is there, it's in really good position, so that's shortened the hamstring for me, all right? I'm going to hook in there into the fibres on the back side of the IT band. I'd like you then to straighten the leg for me. So when I say straighten it, just bend at the knee.
Oh.
Bend at the knee. Okay, try that again. Good. Can you feel the pull through there?
Yeah.
Good. And again, nice and smooth. Excellent, well done. Yeah. I'm going to stretch that tissue down, give it a bit of length, and work along the length of the fascia here, working in the direction of the tissue. I'm going to take this up the leg as well, helping move and mobilise any swelling. Okay, you might want to work across the tissue here. Okay, Jess, if you bring your foot up for me there, that's going to engage the front of the shin here. What I'd like you to do, I'm going to fix into the tissues, okay? I'm going to bring it down. So if you bring your foot down, good, okay, and you're going to do that action back up for me, okay, and again down. Can you feel that?
Yeah.
Okay, so I'm working on tibialis anterior here. I'm just going to support that thumb there, and again down for me. Good. And back up. This is a muscle that often feels a lot tighter than most. It pulls the foot up towards the head, and again down. Good. And one more time. Well done, brilliant. Okay, so just going to work through this calf muscle here with a bit of effleurage and a bit of torsion. Okay, good, well done. Right, this time, Jess, foot down, point, and bring it up towards the head. Good, well done. So you feel like micro stretches all the way along the length of the muscle there, Jess. Again, good. One more time. Excellent. And again. Well done. Good. Good. Here with lower back pain, okay, you can use obviously you're sitting on the ball and leaning against the bed. All I'm going to do is apply a bit of pressure down towards the lumbar spine, the lower back, okay, where the hip meets the sacrum and the lumbar spine is meeting the sacrum. All we need to do is I'm going to apply that pressure down, okay. I want you to take your head forward, and you should feel like a pull through the musculature running from there up the back. Can you feel that?
Yeah.
Okay, back up for me. And again, nice and smooth down. Good. You comfortable with that?
Yeah.
Good, back up. And again down. Good, how does that feel?
Yeah.
Good, then we can do something slightly different. What I'd like you to do is just lift that. What you're going to do is twist as you go down. So you're going to bend that elbow and go across that direction. So that's it, good. So you feel like a bit of a twist. Good, okay. And again, same thing. You okay with that pressure?
Yeah.
Good. Do the same the other side for me. Okay, I'm just going to hook in a slightly different way there. Okay, and down. Good. If you try and lean across diagonally, Jess, it'll give you a bit more of a stretch. Can you feel that there?
Yeah.
Good. I'm going to walk up the back now. Okay, go straight. I want you to go straight down for me. Okay, I'm going to use 2 hands down there. Go down. You'll feel it on the one side, your right hand side. Can you feel that?
Yeah.
Good. Back up. And again down. Good. Okay. And then I can work it on the opposite side too. Okay, I'm just going to hook in there. Go down for me, Jess. Good. And back up. Pull it down into the muscle there. Good. And back up. And down. Excellent. Right, I'm just going to work into the tissues here for you. Okay. So you're going to feel like a drag down with the fingers. Again, lower your head down to chest. Excellent. Well done. Good. And again, back up. Does that feel okay?
Yeah.
Okay. And then we can work into the fibres here of the cervical spine. What I want you to do is drop your head down towards the right and turn. That's it. Good, good, good. Back up. Try that again for me. Yeah, can you feel that?
Mm-hmm.
Good. And nice and a bit slower this time for me. Good, excellent. And we'll do it off to the left this time. Okay, so drop down and twist. Excellent, well done. Good, back up for me. And again, down. Good. Okay, you're going to feel me draw back on the tissues here. Okay, so I'm going to draw back through upper trapezius. I'm going to take your head down towards your chest and you'll feel a pull. Good, okay. And I can continue that until we eke out all that tension in the shoulders and the neck, okay? I'm going to Right then, Jess, so this here is kinesiology taping that's going to help support the client for lower back pain, okay, which is often felt in the lumbar spine or across the sacroiliac joint at the bottom there, okay, and if we get Jess to turn around, the yellow tape is going to add a bit of support for the bump, especially in the final stages of pregnancy where things are getting a little bit heavier at the front. Okay, so that's kinesiology taping for bump support and back pain.